Hello, my name is Eman, and the topic I'm going to discuss today is Rett Syndrome. What is Rett Syndrome? Rett Syndrome is a rare genetic, neurological, and developmental disorder that affects the way the brain develops. It causes a progressive loss of motor skills and speech. It is caused by a MECP2 gene formed in the X chromosome. This disorder primarily affects girls. Why is Rett syndrome usually found in girls? Females have two copies of X chromosomes and male have one X and one Y chromosome. The MECP2 gene is found on X chromosome, so females born with one normal and one changed copy of MECP2 gene usually develop the symptoms of Rett syndrome. So that's why males with Rett syndromes are very rare. Now let us come towards the symptoms of Rett syndrome. Babies with Rett syndromes are typically born after a normal pregnancy and delivery. Most of them behave normally for the first 5 months. After that, the actual symptoms appear. The most evident changes occur at 12 to 18 months. Symptoms vary from one child to another child. The major symptoms are like slow brain growth, loss of normal movement and coordination, abnormal hand movements, seizure and breathing problems. There are 4 stages of Rett syndrome. The first one is early onset. Signs and symptoms are subtle and easily overlooked during the first stage, which starts between 6 and 18 months. Babies in this stage may show less eye contact and start to lose interest in toys. They may also delay in sitting or crawling. The second stage is rapid deterioration. Starting between 1 and 4 years of age, children lose the ability to perform skills they previously had. The loss can be rapid or more gradual, occurring over weeks or months. The third stage is plateau. The third stage usually begins between the age of 2 and 10 years and can last for years. Although problems with movements continue, behavior may have limited improvement with less crying and irritability. Seizures may begin in this stage and generally do not occur before the age of 2. The last stage is late motor deterioration. This stage begins after the age of 10 and can last for years and decades. It is marked by the reduced mobility, muscles weakness, and joint contraction. Understanding, communication, and hand skills generally remain stable or improve slightly, and seizures in this stage may occur less often. Now let us come towards the treatment of Rett syndrome. Although there is no cure of Rett syndrome, treatment is directed towards the symptoms and providing support which may improve the potential for movement and communication. The treatment has to be taken throughout the life. There are treatments that can help children and adults having Rett syndrome. The first one is regular medical care. Medication may be needed for breathing irregularities and motor difficulties. Anticonvulsant drugs may be used to control seizures. The second one is physical therapy. Exercise can improve coordination and movements in patients with Rett syndrome. A physical therapist can design an exercise program that can help patients perform daily activities more independently. The next one is occupational therapy. The goal of occupational therapy is to reduce the burden of their physically and mentally disabilities, improve their functional ability in daily activities. The next one is nutritional support. If there is insufficient food intake over a significant period of time, growth may slow down. An adequate daily intake of carbohydrates, proteins, and fluids are essential to maintain good health. The last topic I want to discuss about Rett syndrome is how long can a child with Rett syndrome live? While it is known that Rett syndrome shortens lifespan, not much is known about specific life expectancy rates for people with Rett syndrome. It generally depends on the age when symptoms first begins and their severity. On average, most individuals with the condition survives into their 40s and 50s. I hope this video was informative for you all. Thank you so much for watching it.